Hello everyone, I am Dr Parag Lad. I am a hand surgeon from Thane, Mumbai in India. We are going to see what are the special tests for examination of ulnar nerve. Here is the list of muscles innervated by ulnar nerve. The injury is usually classified as intrinsic muscle paralysis, like in low or high palsy, or extrinsic involvement in which there is a high ulnar nerve palsy. The test for intrinsic muscle paralysis. First test that is described is called Froment sign, where compensatory thumb interphalangeal joint flexion is seen because of predominant action of flexor pollicis longus. It is seen because of weakness in adductor pollicis muscle, which is innervated by ulnar nerve. The next test is for first dorsal interossei vesting, where we see vesting of the first dorsal interosseous muscle, which is innervated by ulnar nerve. Cross finger test. It is the test to see or examine second dorsal and first palmar interossei muscle, as shown in the video. There is inability to take or cross over index finger over the middle finger and middle finger over index finger, as shown in this video. Next test is testing hypothenar muscles, mainly abductor digiti minimi, which is innervated by ulnar nerve, and in ulnar nerve palsy the hypothenar muscles are wasted and the function of abductor digiti minimi cannot be elicited. There is Duchenne sign, which is nothing but hyperextension of metacarpophalangeal joint and flexion of interphalangeal joint of ring and small fingers because of paralysis of lumbrical muscles for ring and little finger. Next comes is a Bouvier's maneuver. It is the test to study the integrity of central slip and lateral bands. In ulnar nerve palsy, there is ability to extend interphalangeal joint with MCP joint inflection passively, but inability to extend IP joint when the MCP joint is held in hyperextension. Next test is called Petrus test sign, where middle finger is radially ulnarly deviated due to paralysis of second and third dorsal interossei muscle on either side of the long finger. The person has inability to perform radial and ulnar deviation of long finger. Next is card test. It is because of loss of abduction of palmar interossei muscle, causing weakness in seizure strength of index and middle finger, as shown in this video. Next is Massey's sign, where there is loss of hypothenar muscle and flattened palmar metacarpal arch. It is also called as reverse metacarpal arch. Wartenberg sign, which is nothing but inability to adduct little finger It happens because of paralysis of third palmar interossea muscles of small finger. Because the palmar interossea muscle is paralyzed, the extensor digitorum communis of small finger acts predominantly, and the small finger is held in extension and causes inability to adduct the small finger. The test for extrinsic muscle paralysis is, first muscle that is to be tested is flexor carpi ulnaris, where patient is asked to flex the wrist towards ulnar deviation and examiner palpates the contraction of flexor carpi ulnaris muscle. Next is Pollock's test, where it is the test to examine flexor digitorum profundus muscle's action by testing passive DIP joint flexion by keeping the fingers PIP joint in straight position. As shown in this video, the FDP is weak in middle ring and small finger, and PIP joint action of FDS is strong. So in Pollock's test, there is inability to flex DIP joint of middle ring and little finger. Next is Jenny's sign, where there is a compensatory thumb metacarpophalangeal joint hyperextension and adduction of thumb by EPL tendon, which is innervated by radial nerve, when person is asked to do key pinch by touching the pulp of thumb to index finger pulp. It is called Z sign or Jenny's sign. In sensory examination, if any injury in mid forearm or proximal to that, there is a loss of sensation on dorsal and ulnar aspect of ring and little finger, and any injury distal to the, or at Guyon's canal or distal to it, there will be a sensory deficit on the palmar aspect of ring and ulnar ring and little finger, as shown in this picture. The mnemonics to remember: alphabet A to P except G and O. These are the tests that are useful for examination of ulnar nerve. Thank you for watching this video. I hope you like it.